Hello.
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 Good morning, good afternoon, good evening. Welcome. We are live and really excited about our first event that we're running, but Sharon's going to tell you all about who we are and what we do and all that fun stuff. Thank you for those who've already logged in. I know that we're going to get more. And I'm going to hand on over to you, Sharon.
Thank you, Shabnam. Well, hello, everybody. From wherever you're dialing in from, I wish you a good morning, good afternoon, or good evening. My name is Sharon Hall, and along with Shabnam Weber and Nayantara Palchaduri, we are pleased to welcome you to this first International Alliance of Women in Tea webinar. Together, Shabnam, Nayantara, and I founded the International Alliance of Women in Tea with one simple but powerful mission: to create a world where women at every level of the tea value chain can thrive, contribute, and lead with confidence. From the field to the factory, the boardroom to the marketplace, we are united by a shared commitment to empowerment, inclusivity, and sustainability. At the heart of IAWT is the belief that when women are supported and uplifted, the entire tea industry will flourish. We want to foster a culture that celebrates the diversity of women in the tea sector, from different backgrounds, experiences, and perspectives, all working together towards a common goal: creating a more equitable and sustainable future for everyone involved in the tea supply chain. As we embark on this journey, we are committed to addressing the unique challenges faced by women across the globe. We aim to break down barriers, amplify our voices, champion practices that really promote social and economic sustainability. Through our international collaboration, we will share best practices, insights, and resources, ensuring that each and every one of us has the tools to succeed. Today, as we come together for this inaugural webinar, we don't just want to talk about change, we want to find ways to deliver change. With your help, we want to create a global community of people, women and men, who are willing to be part of a supportive network that empowers women to lead with confidence and helps us to create an environment where every woman's potential can be realized. Please get in touch with either me, Shabnam, or Nayantara if you have ideas of how we can achieve this goal, or you would like to suggest subjects that we could cover in the future. Thank you for being part of this important moment. We look forward to the conversations, the connections, and collaborations that will shape the future of women in tea. And with that, I would like to hand back to Shabnam Weber, who will introduce today's webinar and our guest speakers.
Well, thank you, Sharon. I'm really excited about this. I know that we've been talking about this for a year, and I think everybody should know how we actually started this whole little endeavor. It was 3 women in India last January, right? January 2024. And it was at the end of a conference, and it was actually the FAO meeting. And it was as we were all departing to go home, having a quick cup of tea at breakfast, right? And
Yep.
I say this to anybody who asks. This is how you get things done. We said it really quickly and briefly to each other. We committed it to each other, and in the next few hours, we had a name and a website, and we were ready to sort of get going. So I'm really honored to be doing this with both of you. So thank you.
Same. Thank you.
So we are really excited about our first event. We've gone back and forth a lot about, where do we start? What do we do? As Sharon said, sort of figuring out what is our mandate and all that fun stuff, things that you don't actually think of when you say, let's just do this and let's dive in and ask questions later, which is kind of, I think, the way that we've done this. But I think that's a good thing, because that's how you get things launched and going. So I think that a lot of roads lead back to women's health when we're talking about women and the issues that women have, et cetera. And health takes on many, many, many different forms. I think that we're sort of in a place in the world at the moment where, the role of women and the importance of women and protecting women is more important than ever before. We're seeing, rights being degraded around the world rather than advancing. There are certainly parts of the world where we're regressing. And so I think that what we're doing right now is at a very, very opportune moment. We decided that health was the place to start for us because, as I said, there's so many different directions that health can go. And, the health of women in rural areas in particular, because focusing obviously on the world of tea was key for us in terms of, the conversations that we're having. And the women in tea, the vast majority of them are indeed in rural areas. So it seemed like a natural to start there. I really hope that we're able to paint a picture from two different regions for you. The focus today is going to be on, as I said, women's health in rural areas, particularly and specifically. It's obviously going to touch on the tea world, but our two guests work within the regions that they're going to talk about, and not just within tea. And what I think we really hope that you get out of this webinar is the effects and the benefits and how much of a difference it makes when we actually focus on this very, very important subject that so many of us take for granted in different parts of the world. So with that, I'm going to kick Sharon and I off of the screen, and I'm going to leave Nayantara on the screen with our very first guest.
Thank you, Shabnam.
Thank you.
So, friends, it is indeed a great pleasure and honor for me to introduce to you Dr. Sujata Datta, who is a well-known medical professional and whose dedication to healthcare and unwavering commitment to patient care has earned her a distinguished reputation in the city of Kolkata, where she currently works in the field of obstetrics and gynecology. Born and raised in a family of doctors that valued education and service, Dr. Sujata Datta developed a passion for medicine at an early age. She pursued her undergraduate studies in medicine at the prestigious Calcutta Medical College, where she graduated with honors. Her thirst for knowledge and her desire to excel led her to specialize further, earning a postgraduate degree in obstetrics and gynecology from the Royal College of Obstetrician and Gynecologists, UK. Subsequently, she was also invited to be a fellow of the Royal College. Dr. Datta's journey in the medical field began at some of the most renowned hospitals in the UK, such as Queen Charlotte and Hammersmith Hospital. She worked under the mentorship of leading experts, gaining invaluable hands on experience in minimal invasive surgeries, high risk pregnancy care, diagnostics, and treatment. After having worked in the UK for 12 years, she is now the lead gynecologist at Fortis Hospital, Kolkata, and Bhagirathi Neotia Hospital, where she has not only practiced medicine but also contributed to the development of obstetric services in keeping with international guidelines. Despite her hectic schedule, Dr. Datta plays an active role in mentoring young medical professionals, sharing her knowledge and experience to help them navigate the challenges in the field of medicine. Dr. Datta's personal philosophy centers around the belief that healthcare is a fundamental human right and that every patient deserves the highest standard of care. Her approach to medicine is holistic, considering not only the physical but also the emotional and social well being of her patient. With these few words of introduction, I am proud to present to you our first speaker, Dr. Sujata Datta. Sujata, I will be interacting with you, and at first, I would like you to tell all of us more about your professional career especially the use of new technology in your field? Over to you.
Thank you, Nayantara. Thank you so much for inviting me to be part of this talk. Um, that was a very kind introduction, and I hope to strive to live up to it. So, I work at Fortis Hospital, Anandapur, in the city of Calcutta. This is a tertiary referral unit which caters to the healthcare needs of not only the women in the city, but also the rural population in Bengal and from many other states of Eastern India. Sometimes we see patients from as far as Bangladesh and Nepal. Um, so at Fortis, I started the obstetric services, and my main interest now is minimal access surgery, specifically robotic surgery and bringing technology to the city. So, robotic surgery has changed the way we do surgery because it enables women to get back to work really quickly. The surgery involves very small holes rather than big incisions, so it's painless, it's almost scarless, and the 3D magnification and the flexibility we get with the robotic arms allows us to do the surgery with great precision. And the advantage for our women is that they can get back to work and routine life really quickly. So
Sujata,
with
so we
that,
need to build up the infrastructure of all this in rural areas, right? For robotic surgeries.
yes, I think that's still a far cry because what we need in the rural areas is basic healthcare, which is still a little patchy. But there are lots of schemes and lots of government initiatives that are working towards empowering women and improving their health and lifestyle. And perhaps someday we'll be able to take advanced technology to them too.
Thank you, Sujata. And you are a specialist in women's health issues. So, do you think it is important to give more focus, more attention in advancing these women's health issues in rural areas? Because I know for sure that you are attached to many villages in West Bengal, and through NGOs like the Rotary International, you also do a lot of health camps, and you create awareness about women's health issues in the rural areas. So do you think that we should give more focus and attention to some of the areas?
That's right. I mean, for a nation to progress and develop and any community to improve their current situation, women need to be part of the workforce because they make up 50% of the population base. However, the truth is that in most rural areas, women that are in the workforce are actually employed in low skilled jobs with poor wages. They don't have any sick leave. They don't have, advanced skills. They don't have any health insurance schemes. And therefore, they have real difficulty accessing even basic healthcare. Um, I was just talking to Noyantara the other day, and you told me that your tea garden actually employs 60%. 60% of your workers are women, which is a
That's right.
great number. But you told me that these women have to work really hard because not only do they have to manage their the work at home and childcare, they then have to go out to the tea gardens and do manual labor, which is difficult. They have the same repetitive task, which makes them prone to musculoskeletal injuries. Monsoons can be difficult because there's flooding and there's contamination of drinking water with sewage occasionally, and sometimes we see a spurt of diarrheal diseases. Communicable diseases as well are common, such as tuberculosis. There are chronic health problems such as hypertension, diabetes, which are common in the Indian subcontinent. Vaccination coverage needs to go out to a lot of women in order to prevent these communicable diseases as well as cancers such as cervical cancer. But these women cannot access healthcare. They can't leave because of their daily wage earning. They can't leave to go and queue up at the government facilities or facilities that are further away that will eat into their time. And so the truth is that healthcare in India is still quite patchy. And although basic facilities are available in most cases, the more complex problems, such as we see in women, they have postpartum hemorrhages, they can get hypertensive diseases in pregnancy, and they need a lot of intensive care. They need essential medication, which are lacking. Blood banks are lacking in the rural areas, and maternal mortality rate is still a concern as a result. So I think we all need to pull together and realize the ground truth and try and do what we can to improve their lot, so that we can bring them on a level playing field with the rest of the women who are there, who have education, who can buy healthcare. Because as Widge says, the people that are not working or working in low paid jobs are really in a dire situation.
Right, Sujata. No, I'm very happy that you touched upon the industry which I represent, because being the past chairman of the Indian Tea Association, we have activated the sustainability cell at the association, and we are working very closely with international NGOs like the UNICEF, addressing women's health issue and also nutrition. UNICEF has specially guided us to establish these nutrition shops in our tea gardens, and we have to now identify proper literate adolescent girls who can actually man this shop and are also aware of the value. um, yeah, so we have, in fact, we've done some research and some collaboration with international NGOs, as I mentioned, and we found a direct link between productivity of the tea pluckers and anemia. So that's becoming a huge issue even now. I know the government has a lot of intervention. They have created a lot of, schemes to help these women, but still, I think this is an area. And if we talk about the many challenges that are there in the area of women's healthcare in India, in the tea industry, there are some specific areas which I feel needs greater attention. It's like you mentioned, prenatal, postnatal care, and others. Would you like to highlight some of these challenges?
Yes, Nandita. So I think in India, the two main problems that we face is inequality of income. Um, People who are educated live in good areas, urban areas, have access to good education, healthcare, and they can buy whatever they want. But wealth is actually concentrated in the hands of a few. And the large majority of the 1.3 billion population of India still lives in the village and the small towns, which don't have this access or these facilities for them. The second problem is the lack of literacy and education. And so women are not aware of what the possibilities are, how they can access help, and what they can do to improve their own lot. Unfortunately, what you do in life here sometimes becomes a function of where you're born and which family you're in. So, but we have to say that in the last few decades, India as a country has made great strides in development of and improvement in healthcare indices. So, for instance, before independence in 1947, um, you would expect to be dead and gone by the age of 32. When I was born, people expected to live for a little longer, till their 50s. But now we can safely assume that we'll be alive at 69 and kicking. So this has happened because of improved access to healthcare, because of better technology, better treatment, newer treatments being made, and vaccination coverage, which in India government has been very successful at covering more than 90% of the population. Still, maternal mortality rate continues to be a concern because of the problems of not having essential medication or better infrastructure for the complex diseases. Transportation to higher centers is a problem in emergencies. And the maternal mortality rate, which used to be about 300 per 100,000 live births, only in 2015 has come down to below 100. But to put it in perspective, in the US, it's below 10. In North America and European countries, it's below 10. So there's still a lot that we can do to improve the situation. Similarly, infant mortality rate has decreased. Health workforce is increased with the building of infrastructure, hospitals in some of them in the rural areas, and the doctor population ratio has now reached the WHO guidelines of 1:1,000 actually. So India's done really well at that. A lot of spending on health, which is actually only 1.9% of the GDP and probably needs to be improved, goes into building this infrastructure, goes into vaccination, goes into training doctors and retaining them in the peripheral areas, because understandably not everybody wants to go out and live in the rural areas because of the lack of facilities. And one of the biggest improvements that have happened is government financing of health in the form of Ayushman Bharat schemes and Sujata schemes, which provides health insurance to all men and women living in this country below the poverty line, so that they're actually able to get treatment from the private hospitals and not only the government hospitals. And the government pays for their treatment in government hospitals. So I think these are all huge changes that have happened for the better. But there's a lot more to be done. And non-government organizations such as the Rotary Club, such as other women's organizations, need to come together and work with the government to try and empower our women. And this stands on 3 pillars. One is to educate them and equip them with the skills that they need to enter the workforce through vocational training. It's to educate them about their legal rights and their social rights, so that they can say no to child marriage, which is illegal, but because of societal and cultural norms still happens, and they then get into this vicious cycle again. They can avoid or say no to harassment at the workplace, gender discrimination, and indeed domestic violence, and be aware that they have the same inheritance rights as well. And finally, we look at their health, not only through treatment of diseases such as chronic diseases, but also through preventive care, looking at vaccinations, providing them with safe drinking water, sanitation, and improving nutrition. We were talking the other day about perhaps trying to grow vegetables within the tea garden, so that your tea workers could, have fresh fruits and vegetables, and in addition to the subsidized rice that they get from the government, but which clearly does not meet all their dietary and health needs. So I think a lot of improvement has happened, but there's still a lot more that can be done.
That can be done, surely. We really need government and corporate intervention, I feel. A lot of corporates are doing a lot of corporate social responsibility, CSR work, but we have to sensitize these corporates to do a bit more on healthcare, and especially related to women. We were having a chat before this webinar, and the big partners we have in the tea industry who can also come in and pitch in. And government initiatives, yes, you did mention some in West Bengal. Even the government of Assam has taken it up very seriously. In fact, they have schemes which support garden hospital infrastructure, which helps, and also the ambulances and providing assistance to the doctors and nurses. We need better quality of medical services in these remote areas. So maybe group hospitals or specialized multi-speciality hospitals is a thought for the future in these remote areas as well. Also, diagnostic clinics, mobile diagnostic clinics is very important in these areas. So these are some thoughts that I thought I'll share with you, Sujata. And with your expertise, is there anything else that you would like to tell us finally before I pass the webinar and the proceedings on to Shabnam?
I think we've covered most of the things that we wanted to say, but I also needed to touch on vaccinations. Um, just as COVID times, we saw India producing its own vaccines. Now, Serum Institute has started producing, a local cervical cancer vaccine. And the developing countries, including India, had one of the highest incidence of cervical cancers because there was no national screening program, there was no vaccination because they were so expensive, people couldn't go out and get it. So now with the new vaccine coming in, we are hoping to be able to vaccinate a lot more young girls between the ages of, say, 12 and 18 before their first sexual contact, in order to prevent HPV infections that would lead to a decrease in cervical cancer incidence. And also there are some initiatives which anybody listening in can join in with the government and non-government organizations in schemes such as in our state where bicycles have been given to girls to be able to help them to get to school and college, and a stipend given to those between 13 and 18 years of age to enable them to stay at school and college and say no to early marriage. So these are all commendable, but one of the biggest changes that's happened is Digital India, with high-speed internet connection being given to most villages, and most families now, even in the villages, have access to a mobile phone and internet, so they can do banking, they can avail of the welfare schemes all online without having to travel. And I think that's a fantastic thing. It's a great change, and it's going to take India forward in the coming years.
Thank you, Dr. Sujata, for sharing your experience and your thoughts with us. And thank you for your time. I know how busy you are. And so with this, I hand over the proceedings to Shabnam.
Thank you. It's always a pleasure talking to you and being here with you.
Thank you.
Thank you, Shabnam.
Thanks to you both. We'll see you back in a few. Okay, well, with that, I have the great honor to introduce our next guest, Widge Woolsey. Widge is the CEO of Ufulu Malawi, which is a charity she founded to combat period poverty in Malawi, where many women lack access to sanitary products. With over 20 years of experience in logistics and administration, Widge has traveled extensively across Africa, first as a child and later during her gap year, earning a BA in English and philosophy. Her career spans roles in advertising, hospitality, and the film industry across Southern Africa, as well as positions in London's financial sector. In 2018, it was a visit to Malawi that inspired her to focus on empowering women by providing menstrual education and distributing cup starter packs through Ufulu. Widge's work emphasizes female empowerment and ensuring no girl misses education due to her period. She divides her time between Henley, where she lives with her partner Rob, and their three-legged collie Billy, as well as Malawi. It's really a pleasure to have you here, Widge. I heard about your organization a few years ago, and really it was through word of mouth within the tea industry. So I was intrigued by it. I clicked on your website right away, and I donated my cup, or a cup rather, not my cup. It was so easy to do that, and then understanding sort of the impact of it, that it seemed almost unbelievable that there wasn't more of it happening. So I'm going to hand to you, Widge, so that you can tell us about you and what you do and how and why and all that stuff.
Thank you very much. It's great to be here, and I hope that what I'm about to say will broaden some people's outlook on how easy it is to make a change to the lives of women. So yeah, I started Ufulu Malawi because I was, as a friend of mine put it, a mildly angry middle-aged woman at the injustice as I saw it. So, as you mentioned, I've traveled extensively across Africa. But in 2018, I met one woman who was brave enough to talk to me about all sorts of things, shall we say. And in the course of our population, we started talking about periods. And And I asked her, what do you use? And she showed me cloth rags. And at that point, I was absolutely mortified. I consider myself an intelligent woman. I'm well traveled. And even though I traveled across Africa and it was virtually impossible to find decent sanitary products, as a woman who has a period, I never once stopped to think, well, if I can't find them, what are the local women using? And over the course of 5 years, that injustice has really built up inside me. And this is why I started the charity. So to give you some basic stats, 51% of the human population has a period. So it is something that affects every single woman that that I know, that anybody watching this knows. Menstrual health is female health. It was very interesting earlier on. Sujata was talking about how they've delved into improving women's health and lack of education. I speak to lots of people who run NGOs or who support NGOs who say, yeah, education is really important and we're going to give money to build a school. And I say to them, great. However, have you considered the fact that 50% of the children who attend that school, i.e. 100% of the females, are probably going to miss 1 week of school every single month simply because they don't have access to sanitary products. It's horrific. Ufulu has given out 23,500 cups since I started up the charity, and we've got a huge way to go. I've got a lot of statistics here that I want to sort of throw out at people. Some of them are pretty horrendous. So I work in Malawi. I am focused on Malawi, but across all areas, both rural and urban. And I have worked specifically with some of the tea estates in southern Malawi, which are very, very rural areas and where the population doesn't have a huge salary. So across Malawi as a whole, 30% of females that we've encountered have only ever used cloth rags for their periods. If you take that to the tea areas, it's 98%. So there you've got already a huge disparity. Again, in the tea areas, you've got to think about, these are hot climates. You've got women who are working with rubber aprons, and they're out in the fields all day. They have access to pit latrines, but it's not what you and I would consider a nice, pristine white toilet with some nice loo roll next to it. 94% of the women in the tea areas that we encountered had what we call nappy rash. This is a rash between their thighs from using cloth rags. You give a woman a menstrual cup, that rash goes within 1 month. Another statistic, across Malawi as a whole, 21% of the women that we have given cups to are single mothers with children, more than 3 children. On the tea estates, 65% are single mothers with children. They are the sole breadwinner. So if they're missing work, the average is 3 days a month. That's 3 days with no pay. You give them a cup, they have the ability to go to work every single day of the month. The tea estates that we worked with, where we distributed cups to all of the female workers, be it in the factories, in the tea fields, in management, it didn't matter. If you were female and you had a period, you got a cup. They all reported that it was easier to go to work. It was more comfortable to go to work. They were more productive when they were at work because they weren't constantly worried about checking to see if they leaked onto their cloth rags or pads. The flip side of that is 6 months later, when we go back to check up on these women, the tea estates reported an increase in the amount of tea that their female pickers picked every day because they weren't rushing off to go and check them. I had one woman in a factory who came running up to me and said, oh, I can do my job better now because I can climb a ladder, because I'm not worried about being leaking on my uniform in front of my male colleagues. Yeah. Menstrual health is female health. It literally affects every single female. The only reason the human race keeps going is we have these amazing bodies that can reproduce, and part of that is having a period. And yet it is seen as shameful.
Yeah.
The knock-on effects are huge. As we all know, education is key.
Yeah.
Okay. But if you are a girl going to school and you don't have access to sanitary products and you miss, let's say, 3 to 4 days every single month, that's 1/4 of your education missed because of a biological condition over which you have no control and no choice. Periods are not a choice.
Yeah.
And it's so easy to solve the problem. It takes us 2 hours to run a workshop for 25 women where we give them their cup, a bar of soap to wash their hands, a recycled baked bean tin so that they can boil the cup clean. Because if they don't have the money for pads or soap powder for their cloth rags, they don't have the money for a cooking pot to boil their cup clean in. So we give them everything they need. It costs us £10, and that cup will last them for 10 years. As I said, the tea companies that we have already worked with have said, yes, it's an initial investment, but the long-term effects are huge. One, we've got better health amongst our female workers, mental and physical. Two, they're working better. The children on the tea estates to whom we gave cups were now attending school. I've got a beautiful video from one of the teachers on Satoma Tea Estate who's just saying, the girls are coming to school every day of the month and they're working better and they can pass their exams. The UN says the easiest way to bring a country up in GDP rankings is to educate its females. But if you miss 1/4 of your education, you never catch up. And it is so simple to solve.
There's a famous quote, and I don't know who it is, and I may be misquoting or not using all of the right words, but the sentiment is the right one. It's something along the lines of you educate a man, you educate a man, you educate a woman, you educate a generation. And there's nice words and whatever, but as you say, we know that these facts are true, right? We know that when women are educated, when women are supported, when women receive, microfinancing, et cetera, they use that for the empowerment of their families. They use that for the betterment of more than just themselves. And, anybody watching, this isn't a dig at men, but it's just statistically the reality of the roles that we play as females in society. What I find always really interesting on this particular subject, which is, you say, and correctly, that 51% of the world are women, which means that 51% of the world either does menstruate or has menstruated, and yet we don't talk about it, and that's not necessarily a tea thing or a rural thing or anything like that.
It's worldwide.
It's worldwide. It's dirty. It's shameful. It's there are all kinds of other words that we use instead of talking about a period. I don't know about how advertisements work in your country, but I remember
blue liquid.
It's a white liquid, right? It's a white clear liquid that they pour onto pads.
Or blue on pads.
Blue. That's my favorite. You're absolutely right.
Yeah.
So we don't talk about it, and yet it's a very natural, normal thing. And
everybody knows someone with a period because we've all had a mother.
Yeah.
We might not know her now.
Yeah.
But we all know someone with a period.
Yeah.
I've the analogy I always use is I've gone up to male and female friends and said, it's slightly more effective with male, and said, my hand is bleeding.
Yeah.
Will you help me?
Yeah.
Yes. Okay. Now I come to you as a woman who's got a period and I'm bleeding, and suddenly it's an embarrassing thing. I went to an all-girls school. Every single pupil was a female. Every single member of staff was female. I mean, it was one of those. And yet every single month when I got my period, I would hide my tampon, because I was using them at that stage, hide my tampon up my sleeve and shuffle off to the toilet because it was embarrassing. And yet every single other person in that building had a period. But this has been indoctrinated into us for better or worse over millennia. You can refer to, for instance, religious texts, and women weren't allowed in the temple. They weren't allowed to cook. In some societies now, they still go away. I mean, to be honest with you, I quite nice to go off for a week and sort of just sit in a little hut and like keep yourself away. But it's because it's seen as shameful.
Yeah.
And yet, period poverty, for me, is the biggest factor in gender inequality.
Yeah.
And in fact, it was interesting when I was working with one of the tea estates, a human rights lawyer came and he was just observing the estates as a whole. He was actually very impressed with what this particular estate was doing in terms of female empowerment. But he came to one of the workshops, he sort of snuck in at the back. And afterwards, gave me a letter of recommendation for the work that we were doing, saying it was the most powerful gender equality project he'd ever seen because it's so simple.
Yeah.
It doesn't take much. We've run workshops in the middle of tea fields, literally, in the back room of a factory, wherever, in a school, in a community group. It takes 2 hours, you give them a cup, and that's it for 10 years. And you improve their health.
So actually, somebody's asked the question, did the females within the tea communities accept the cups? Like, was it, how was well received?
I have I have videos of me turning up to do workshops, and because it was within one tea estate, obviously there are lots of different teams. So we sort of started off with I think we did a team in the factory, and then we did one in the fields, and literally I was doing 2 workshops a day. By the end of the first week, and I was there for a month, by the end of the first week, when I turned up in a tea field to run a workshop, I had these women ululating of like, oh, she's here, we're going to get our cups, thank you so much. We had literally a 99.9% take up. We've given out 23,500 cups. I've had 13 women so far who've said no, and that was some who had, it turns out, cervical cancer, some who had probably fibroids. Obviously, we're not medically trained. We're women who use cups. We've got an idea of what it's like to have a period and how to use a cup. But, you know, we're not doing internal examination, so we don't go down that route, but we gently ask questions to assess if people have been struggling, why they've been struggling. The interesting thing for me was the fact that, as I said, we gave cups to the female workers. Across the tea estates, you've got these villages where all the workers live. So you've got female workers and their husbands, but you've also got male workers and their wives. And their wives, because they weren't working for the actual tea company, weren't given cups. And before I left, we had male workers going up to their managers and saying, my wife's heard about this cup. She's been talking to our neighbor and she says this neighbor's saying it's amazing. And my wife wants to know, when is she going to get hers? So, you know, this is men talking about something which is, you know, very taboo. And going to their managers saying these things are great, and our women, our wives need to have them. When does my daughter get one? Because she's missing school. Suddenly it was literally instantaneous. And the word spread across the community. We can't give them out fast enough.
I'm going to bring the rest of the group on. Thank you, Widge, for that. But we're going to keep talking about this. I'm going to bring everybody else on so that we can discuss. But while I do that, I'm actually going to ask a question that that Emma from Fair Trade Foundations asked, which I'm going to ask Sujata as well in a moment. And that is, Widge, would you ever consider running workshops beyond Malawi and other tea growing countries?
Yes, I would. My charity is very small. It's me and 5 Malawi women. One of the reasons we're so successful, I believe, is because we don't have offices, we don't have 4x4s, we don't have a huge infrastructure. We are literally about purchasing cups and getting them out to the women. I don't run the workshops. I'm not Malawian. I'm not Black. I don't speak to Chewa. You know, I can guide the women. I do all the admin and behind the scenes. I have put cup companies that I've worked with in touch with tea estates. I got asked to go to Kenya, and I was like, look, at the moment, I'm really sorry. I'm based in Malawi, and I've got, you know, 6 million women I want to give cups to there. One of the cup companies I work with is now working with tea companies in Kenya. The cup company I work with at the moment, which is Asan, works in India. I would love to put them in touch with the tea industry in India, because it's very easy to get cups out to a huge amount of women very, very quickly when you work with tea companies. It's a piece of cake. It really is. So yes, is the answer. But I need funding. I'm tiny, and we have to buy the cups and everything else, and we have to pay salaries to our staff. But it's women empowering women, and it just works.
Yeah.
So yes, we would love to. Anybody want to help us with purchasing cups? Feel free.
And the beauty of it, Widge, is it's a simple initiative. It's a simple solution that is deliverable, but it delivers, from everything you've said, can deliver such a massive impact. And what I scribbled down, which was the crossover between your what you said and what Sujata said, is education being critical.
Yeah, huge.
Both the education to find ways to lift yourself up, but also to be healthy enough to be able to go and take part in education. Absolutely critical.
Yes.
Yeah, I mean, to the putting it down to basics, in Malawi, if a child answers a question at school, they have to stand up. And you've got girls who won't answer questions because they're scared that if they stand up, they've got a blood stain on their skirt and they're going to get teased. You know, putting it down to basics, you don't need underwear to wear a cup. They're made of silicone. They last for 10 years. You wear them for 12 hours at a time. They're designed to be worn for 12 hours. So you put it in the morning and you take it out in the evening. You can sleep with it overnight. They literally change lives. Every single female life who receives one. And it's the knock-on socio-economic effects are then massive. Girls get an education. Women can go to work and earn money to feed their family. They have better menstrual health. They have better mental health because they're not feeling grim, is the only way I can describe it. For every female watching this, can you imagine, you know, it's not nice small pieces of cloth. It's a massive piece of cloth between your thighs, and you wear it for 2 hours, and then it's saturated. Where do you put it? You don't throw it away because you need it. So then you've got to put it somewhere, or you just endure the uncomfortable sensation, and it's rubbing your legs, and it's just horrendous. And you solve it by giving them a silicone cup that lasts for 10 years, that they can't feel, that doesn't leak, that doesn't smell, that they don't need underwear. They boil it clean in a tin that's provided to them, and it takes 2 hours to explain how to use it. And that's it. It's so simple. But, you know, in so many rural economies, the simple plans are the most effective because there's nothing to break. And you run it by women who understand what it's like to have a period and to be that uncomfortable and to need to work and to want your children to go to school. And the word we don't advertise. It's word of mouth, and the word gets out, and we've literally got women queuing up. As I said, we can't give them out fast enough.
So, speaking of simple schemes, and I think that's really key. You know, as Sharon said, it's an easy thing to do that actually has an effect, right? Sujata, you were talking about, you know, vaccinations and all the rest of that. And obviously, you know, I can't go and vaccinate anybody. However, what struck me and what I wrote down was this bicycles to get to school program that you had, or that you mentioned rather, and stipends for girls to stay in school. To me, that seems like a simple, it sort of, you know, marries very well with what we're talking about. So can you tell us a little bit more about that? Is that a government scheme? Is that an organization? And how can we get involved?
So this is a government scheme. Here, health is actually the responsibility of the state to a large extent, and then to the center. So a large amount of money comes out of the state budget, and the chief minister of the state, it was her brainchild, and she started this. You know, she pioneered this, and she gave free bicycles to young girls because some of them had to walk for miles to get to school. There was no local school. So it comes sun, and it can be very hot, it can be very rainy, and there's flooding and all of that. And to get to school is difficult. So even if you want to go, sometimes they couldn't. But now that they've been given the bicycle, it has improved their mobility and their sense of independence. And they want to go out then, try the bicycles, get to school, and learn what they can, and gives them a sense of freedom and empowerment. So that's, I think that was a great scheme. And of course, as I said, child marriage is illegal. It's been outlawed by the government of India. But because of poverty, because of societal norms, because of cultural norms, a lot of people still try to marry off their children. If there are lots of mouths to feed, they think it's one less if they get them married off. But then those children get into a vicious cycle of an early marriage, have a family, they're not old enough to look after themselves, they have to look after children, and the cycle of poverty continues. So again, Bengal government said, we'd give you a small stipend. I mean, it'd be laughable if you hear it in terms of how much it is. But it's still something for them, because every rupee counts. And they realize then that that's not the done thing, and they start saying no to early marriages, child marriages, and the incidence is slowly coming down, and they're getting more interested in education. And certainly in the urban areas, we see lots and lots of women pursuing careers, education, delaying marriage, delaying childbirth, which again comes with its own sets of problems, later on in life. So we see, I think India is a country of paradox. And ironically, you see both ends of the spectrum. You see malnutrition, 30% of children under 5 suffer from malnutrition. And in the bigger cities, you see problems of obesity, of people that have too much.
Yeah.
And so it's a strange sort of situation, but you have to understand where you are and be able to deal with both.
Right. Sujata,
sorry, I just want to ask you something, because I find that bicycle idea fascinating. They ran the same project in Kenya, and one of the first things they started to notice there was a decrease in teenage pregnancy, because the girls, they weren't walking to school, they were cycling, so they weren't getting accosted on the way to school, and they weren't falling pregnant. We've noticed a similar thing in Malawi in terms of giving cups. We sadly had girls who were desperate to buy any kind of sanitary products, so were sleeping with men to get money to buy pads, and then falling pregnant. And it's the cycle of poverty, as you say. And I think what we can all agree on here is that small differences in women's health can have a massive knock-on positive socio-economic effect. You get a girl in school, you give her the chance of education, you decrease her chances of getting pregnant, you get her to understand her body by giving her a cup, or being able to get to school without being accosted because she's suddenly got a bicycle and she's less tired. And the positive knock-on effects across the next sort of 10, 15 years of her education, we're only just starting to see the ripples, but they're huge.
Yeah. Nayantara, you were going to say something?
Yes, we in our tea gardens haven't reached the cup stages yet. We are still creating a lot of awareness. In fact, Sujata brought in a company which produces these cups and tried to create awareness, but we still need to work harder. But what we have done in some tea estates is get these sanitary towel dispensing machines easily available to the labor force and at a very subsidized rate. And also some of the women, it's a skill that we impart, producing these towels with biodegradable products, so that it can be disposed of very easily.
I think it's very interesting. Sorry, carry on. I was going to ask you something, Widge.
Go for it.
So it's good to be able to interact with, all of you from different countries and get a perspective of the social norms everywhere. India is still a very conservative society in comparison. And girls are sexually active at a much later stage, some still not till they're married. and virginity is still quite a valued thing in the marriage market, still in the rural areas, and that's the reality of it. And so, as Noyantara says, we went out with menstrual cups and we gave it to women and we talked about it. The uptake, I think, was less than I would have liked it to be. And I was wondering whether it was because of this, because certainly young girls who were menstruating, who'd never been sexually active, would be very uncomfortable, and their parents would be very uncomfortable with the even the idea of something being inserted into the vagina and being kept there when they'd never been sexually active at all. And I think this is perhaps one of the reasons I felt in my mind why it wasn't as successful. And so we're still not at that stage where we can distribute it universally, but certainly for women, married women, women who've had children, it's fantastic. And I felt the uptake there was a little better.
That's right.
I understand your concerns. I had an awful lot of people saying to me they won't use them. And this is why whenever we take on a new cup lady, she's giving out cups in the area in which she lives. She's known to the people that she is giving cups to. We always go and meet with the local chief. Africa, in Malawi especially, can be quite tribal. The chief doesn't really have a huge sort of active role, but they are known within the community. And what it boils down to is it was a choice. It's always a choice. We tell them about the cups. And one of the things we say is, this will not stop you from being a virgin. And we put it in very, very basic terms. And I will say to girls, or my cup ladies will say to girls, if you put a finger inside your vagina, you're still a virgin. If you put 2 fingers inside your vagina, you're still a virgin. Then we make a joke out of it and said, if a banana went inside your vagina, you're still a virgin. But if a penis goes inside your vagina, you are not a virgin. And if you say it in a jokey way like that, and, everyone's sort of just giggling a bit, but it gets the point across. And we explain this is better for your health. Again, Nyantra, I have a lot of people say to me, oh, we give reusable pads. Great. People say to me, this is, we can create a community of women who are making these pads and they earn extra money. Great. However, to anyone who says that, I say, have you ever worn a reusable pad yourself? In a very hot and humid climate where you're working all day long, and it's the smell that for most people, for most women, they find off-putting, and the fact that you're worrying about them leaking onto your clothes. And why give someone a reusable pad when they've got to have the money to buy the soap powder to wash them? They've then got to hang them up. Well, they're not allowed to hang them up outside because it's seen as shameful. So then they put them in cupboards or under sleeping mats, and they're used when they're moldy and they're damp and they can cause more infections. Cups have been around since 1937. It's nearly 100 years, okay? They are a reusable, hygienic, comfortable solution to a biological condition that 51% of the human population has. It's the 21st century. People are using mobile phones. People can bank with their mobile phone. Why are women still using products that ostensibly are uncomfortable to use? I started off using pads. I did a lot of swimming. I played a lot of sport. They were horrific. They squeeze down to nothing. They don't do the job that they're meant to do. You educate girls gently with their peers and their teacher by going to their school and explaining, there's no shame in using a cup. I've used a cup for 15 years. I then went back to using a tampon because I was at a friend's house and I didn't, I'm at that age where you never know whether it's coming or going. And I had to ask to use a tampon. It was horrendous. Then the tampons are this shape. That's not the shape of your vagina. Your vagina is that shape. I can't do it properly in the camera. Cups are designed by women, for women. They don't give you infections. They don't make your vagina bigger. They don't stop you from being a virgin. They don't stop you from having children. They just enable you to live your life in comfort for that 1 week a month, where we all know what it's like if we're female. You know, I've joked with friends saying you spend half your life dreading your period turning up and the other half of your life dreading if it doesn't. You know, you are bound by
sad
them.
when it's gone.
Yeah,
Sad when it's gone.
You know, there is a solution.
Yeah.
And it's so simple.
So, on that, and you know, this is we, you know,
We could talk all day.
We were a little bit worried about how we're going to fill an hour, but here we are, and zimzalabim, an hour is over. Before we say goodbye to you, Widge, and you, Sujata, I think that Catherine's question is, or her comment is a really good way to sort of wrap up here, and that's she says, "Thank you for organizing." Thank you, Catherine. So many points where she feels responsible buyers can be supportive. So on that word supportive, Widge, can you share with everybody your website and how people can go and make a very quick and easy difference? And Sujata, I'm going to ask you as well. Is there an organization, is there anywhere that you would direct anybody watching? And remember that this is recorded and we're going to post this everywhere. So that you would suggest as well. So I'll start with you, Widge, your website.
I haven't got organized, so I'm just scribbling down, and I don't know if this is going to work. Does this work on the camera?
It does.
There we go. So I'm going to hold it up.
Yeah.
So that is my website, ufulu.org. Sorry for the scribble. As I've said, we don't have huge overheads. It costs me or my charity £10 to give a girl or a woman everything she needs for 10 years. I'm going to hold this up again because I'm sure people have. So it's ufulu.org. That means freedom in Chichewa, which is the language of Malawi, because that's what we're giving women. There's lots of information on the site. We have a donate page. I can guarantee you that, you know, if you donate £1, 98 pence of that pound goes towards purchasing cups. 2p goes on admin, which is probably the complete antithesis of your larger organizations that have offices and transport and bills and everything else. I set this up to give women and girls cups. That's all I care about.
There's a big pink donate button on the top right-hand corner.
Yes.
Easy peasy.
There's lots of donate buttons across the website. So I say to anybody, if you go out to a tea or coffee shop every day and buy yourself a cup of tea or coffee, just think about it, in the UK, 2 cups of tea or coffee, that will give a girl her education for 10 years. It's that simple.
Yeah. And
thank you very much.
Thank you, Widge. Sujata, what about you?
Yes, most of the social work that I do is with the Rotary Club of Inner City. And I'm going to let Noyantara take that question because she was the district governor and she does a lot of, it's one of her many hats. She was the district governor of Rotary and she does a lot of social work on their behalf. And she will give you the details of how to donate. And I know they've got an account where overseas donors can
Perfect.
Well.
I'll give you the details, Shabnam, because there are some rules, very difficult laws and compliance issues for receiving foreign funding. But I will give you the details and perhaps you can share it later with all the attendees. And what would really help is, you know, what Sujata mentioned is the cervical cancer vaccines. They are still a bit expensive. So if we can get some support for that, that would really help, right, Sujata?
Yeah, that's the need of the hour. And with the cheaper vaccines coming in, we can vaccinate a lot more young girls than we could for the same amount of money. So we didn't really, we did awareness camps and we talked about it, but we couldn't really give them the vaccination because each shot costs a lot and you need 3 shots. So now that the cheaper vaccine is coming in, I think if we have the budget, we can go out and vaccinate a lot of young girls. and protect them from cancer long term.
So let me ask you, no, and that's really good to know, but let me ask you this. How can I, sitting in Canada, or anybody who's going to watch this later, how can I contribute? How can I help with that cervical cancer vaccine?
Right. About the funds?
Yeah.
Yes, as I said, there are some rules and regulation. We have what is called NGO needs to have a FCRA, Foreign Contribution Regulation Act. It comes under that. So the clearance has to be there. That's why I'll send the details to you.
So it's through the Rotary.
Yeah.
It's through the Rotary, and we, of course, the donor will be kept well informed about the beneficiaries.
Perfect. Either you, Nayantara, or Sujata, quick question from Fair Trade. How much is a vaccine shot?
How much is a vaccine?
Yeah, so the international one, which has been around for, which we've been using, the latest one, the one that's internationally used, the MRP is 10,850. So that's what, 108 pounds per shot, something like that. Is it?
Wow.
That's a lot.
And that's
And
a
you
lot
need
of
3 of
money.
those.
But the new ones are going to go around for about 300 to 400 rupees. So that's about 30 pounds.
Amazing.
Wow. Okay.
Yeah, that's brilliant.
That's a big difference.
Or less, actually. Yeah, it's far less. Sorry, I think its equivalent is around 100. Then 300 would be what? 3 or 4 pounds. That'd be fantastic.
Oh
That's
my
incredible.
That's a big
that's
difference.
So exciting.
So thank you
Oh.
to you, Widge, and thank
Thank
you
you.
to Sujata for being our first guests. Really, really appreciate your time. Thank you.
Shall I wrap up?
Yeah, just 1 second.
Yeah, I add my thanks as well. It's been an absolutely fantastic conversation, and I see so many points for action for the IAWT as well, which is absolutely brilliant. I just want to capture a couple of the key points from our speakers. Sujata's 3 pillars: educate, know your rights, and the importance of health. Collaboration is key, and I feel like through our IAWT we can create those networks for collaboration. Simple initiatives, be they cups or bicycles or another, really do have an impact. And I'm going to take Widge's words: small differences in women's health can really have a massive socio-economic impact. So as Shabnam and Nayantara said, we will share all the links where you can donate. And we will use the outcomes of today's discussion to really think about where we go next with the IAWT. We'd welcome your feedback. Thank you to everybody who joined today.
Thank you. Thank you all.
Well, ladies, thank you. It's we did our first event, so yay us. And yeah, enjoy the lovely day.
Thank you, Shabnam.
Thank
Thank
you.
you,
Really
Nayantara.
organized it so well. Thank
No,
you.
no, thank you to all of you. Thank you.
Bye.
Bye.
Bye.